Hi, my name is Dina Muscat-Meng from Cochrane, Denmark and Cochrane Sustainable Healthcare, and I'll be talking about how to consider the use of plain language in your dissemination product. In this presentation, we'll be going through checklist items 2, 3 and 14. The first checklist item is number 2 and emphasises the importance of using plain language when communicating. The use of plain language in dissemination products is widely recommended and does not always mean lay language. Plain language is writing that is clear, concise, well organised and follows other best practices appropriate to the subject or field and target audience. Plain language is not only helpful for patients and consumers, but for any person who is not an expert in systematic review methodology. If possible, try and avoid research jargon. Try instead to use the actual names of the intervention, comparison or outcome, and avoid terms tied to risk of bias and study design. Review authors have already taken these issues into account when they assess the certainty of the evidence, so it's not usually necessary to refer to these issues again. Plain language doesn't always mean avoiding medical terminology. Some audiences, such as healthcare workers or people with chronic conditions, may be familiar with medical terms. Others may find it helpful to learn certain terms and concepts. But where you do use medical terms, make sure you use them consistently and think about whether you need to explain what they mean. Use words that are familiar and acceptable in your setting. Some words or terms are only used in some parts of the world. For instance, general practitioner is common in some countries, while family doctor is common and easier to understand in other countries. Similarly, people may not see themselves as consumers, but they may prefer to be called patients or healthcare users. Some other general tips include remembering to use the active voice. Traditionally, the passive voice has been used by scientists and medical professionals on the basis that what happened was considered to be more important than who did it. However, use of the passive has declined, and our dissemination products should use the active voice where possible, as it's generally more accessible and a clearer way of defining responsibilities and relationships. Do also remember to keep sentences and paragraphs short, and where possible avoid abbreviations. We will now go through checklist item number 3, which highlights the need to consider the words in your title and if they will likely target your intended audience. In these examples, the Blogshot authors have presented the same review in 2 different versions, one for midwives and one for parents, and have chosen title words that the 2 different target audiences are likely to search for, recognise and find relevant. It can be helpful to use links, pop-ups or boxes to offer additional information or explanations. But do remember, not everyone has reliable access to the internet, particularly in resource-poor settings. People may also overlook explanations if they are not placed close to the terms they are referring to. In checklist item number 14, we look at how to present findings in more than one way. As you can see from the summary on the right-hand side, the summary is presented both with text and with an extra layer with figures from the review. People may prefer a combination of words and numbers when reading about Cochrane reviews. Seeing findings presented in both words and numbers may also help people feel more confident in their understanding of the numbers. Video 6 is part of a series of videos on the dissemination checklist. And to download our checklist, search online for Cochrane Dissemination Checklist. Thanks for watching.